I entitled this video Shifting Sand because basically I want to talk to you about understanding the difference between fillers and fat transfer, because this is a huge question that everyone asks. Should I just use temporary fillers? Should I just use fat graft, or should I go with fat grafting? What's the difference between the two, and what's the timing? Fillers to me are a really wonderful way to get things done immediately with very little recovery in the office. You immediately see the results and people are in love with it. It's a wonderful technology we have nowadays that people don't have to be sedated to have a procedure done and still get wonderful, wonderful results. Fat transfer to me is great because it's permanent and allows me to create the most glorious results because I can shape a lot of little places that I simply cannot do with fillers. So how do you make that decision between fillers versus fat grafting? Well, fat grafting is more expensive, but it is permanent and it's more global. So I always say if you can't afford the fat transfer, consider doing the fat grafting with a few caveats. Now, let's say you're 35, 38, and the fat grafting is a little bit more expensive, you want to spend, something you don't want to necessarily do. Well, the fillers are really, really good. As you get into the 40s and beyond, the fat graft starts to divide, and the fat grafting becomes much, in my opinion, much more powerful, because let's say I put 35 cc's or milliliters of fat into the face, whereas each time I put fillers in, I'm putting 1 cc, 2 cc's, 3 cc's, I'm slowly building it. It would cost you more than a fat graft to get you a result that's even close to a fat graft, and I can't do areas like the brows or other areas because it's harder for me to manage that with very hard product like fillers, whereas fat is very, very soft. So I always say, if you came in at mid-30s or late 30s and the fat grafting is a little bit beyond where you want to go, well, do fillers. But if you are a little bit older and you have this disposable income and there's more aging going on, really consider the fat transfer because it provides a permanent, more global rejuvenation. Yes, albeit with more expense and some recovery time for that week or 10 days when you don't look so good. But something at least like my mother, who's 3.5 years out, looks fantastic. So fat grafting, I call it the Ferrari, and I call the fillers the Porsche. Just as a guy, I think about cars, but it's just the idea that one is just so much better than the other, but the other one is still excellent. So those are ways to understand decisions between fillers versus fat grafting. Which one should you do? Now, does fat grafting work for everything? No. There's a video that I encourage you to watch called Face Like a Bed, where little creases, little lines, little areas that actually work better with fillers. So certain things fillers work better for, certain things fat grafting work better for, and something I combine the two. Now, how do I combine them? What is a sequence that I would prefer to do? Could you come in, do some fillers, try it out, see if you like it, then come back and do fat? Well, that's not really ideal, because the idea is that if I put temporary fillers in and they're sitting around there, and now I've got product all over the place, and now they get more and more fillers, because people, when they do fillers, they like it and they do more and they do more and they do more. Then I'm up to like 10 syringes of product all over the face that I got to somehow dissolve and remove and move to fat grafting, which is very, very hard to do easily, because when I dissolve it, some of your natural collagen does go down for a while, does take a while to come back up. And so my goal is really, if someone can do fat grafting, go toward that direction. Don't do fillers, because the fillers are, as you get older into your 40s and 50s and 60s, more inadequate to do the results than fat. And I call it shifting sand because the idea is it's like building a house on shifting sands. If I put permanent fat grafting on top of temporary fillers, then temporary fillers are going away as I put a permanent fat grafting on it. First, I'm designing a permanent work on top of temporary housing, plus the fact that as this is going away, you think, well, why did I spend all the money on permanent fillers? So permanent fat grafting. So it's ideal to build the permanent filler first, or permanent fat grafting first, and then on top of that house, I can put a little bit of temporary product. Let's say a little fillers left, a little wrinkles left, a little creases left that I want to fill. I have both temporary and permanent products for small little areas of the face. I don't believe in putting a huge amount of permanent product all over the face, except for fat. But what we can do is, let's say 6 months to a year after the fat grafting, come back, use a little Artifil, use a little restylane, touch up little tiny areas where the fat is not perfect, because remember, the face like a bed, it really fills up the foundation work well, like the mattress, but it doesn't fix the creases, the wrinkles, and all those little things. That's what fillers and Botox does.